Hello and welcome to Beyond the Chart. I'm Michaela Gilman, a student nurse practitioner, and today I'm excited to share the results of an important quality improvement initiative involving the social determinants of health right here at Southern Clinic in Dothan, Alabama. A little bit of background: what are the social determinants of health and why do they matter? Well, when we think about health, we often focus on things like medications, lab results, and diagnoses. But we now understand that up to 80% of a person's health outcomes are determined by factors outside of the exam room, things like housing, food access, transportation, and social support. These are known as the social determinants of health. They influence everything from how likely someone is to follow a treatment plan to how often they come to appointments or even how safe they feel in their own homes if they have one. For primary care providers like us, screening for social determinants of health is not just helpful, but it's essential. Screening for the social determinants of health in our area is very important to help us reduce the barriers for our patient population, prevent disease, and make sure the public and our patients are informed of what risks are highest in our area. My screening project was implemented at Southern Clinic, a primary care family practice clinic that's located in Dothan. It's part of Houston County and the southeasternmost corner of the state. Dothan is considered a rural to suburban area and is recognized as a health professional shortage area for primary care. Southern Clinic serves a diverse patient population ranging from Medicare and Medicaid recipients to uninsured patients and those with private insurance. Many patients face financial strain, limited access to transportation, and food insecurity, making it an ideal location to address the social determinants of health. The methods we used to implement this screening was we used a 8-question version of the WellRx screening tool adapted from the original 11-question format outlined by the Page-Reeves study. These questions targeted key areas like food insecurity, housing stability, transportation needs, utility affordability, safety concerns, social isolation, employment issues, and access to healthcare or medications. The screening was conducted in the patient exam room. After reviewing vitals and chief complaints, I introduced the screening as part of routine care, verbally asking each question and documenting the responses on a standardized form. So what were the results? What did we find? During a 2-week period, 25 patients were screened using our tool. Of those, 60% reported at least one social determinant of health challenge. 40% reported 2 or more areas of concern. The most common issues reported were food insecurity, transportation barriers, and trouble affording medications. Based on the responses, 12 patients were referred to community resources, including the Wiregrass Food Bank, Dothan's Wiregrass Transit Authority, and medication assistance programs offered through local pharmacies and the health department. Based on the responses, 12 patients were referred to community resources, including the Wiregrass Food Bank, which is a non-for-profit food bank operating. There is no paperwork needed, no one is turned away. They have ready meals and they operate on Sundays. The Dothan Rescue Mission also offers free ready meals and food boxes to those in need. Dothan's Transit Authority is a non-for-profit that operates 20 vehicles and gives free rides, which is beneficial, helping those with the transportation barrier to keep appointments. Of our analysis, the key takeaways from our implementation were: patients were very open and appreciative when asked about their social needs, especially when the conversation was approached in a respectful, non-judgmental way. Many had never been asked these questions in the clinical setting before. Some patients initially declined the resources, citing pride or past bad experiences, highlighting the need for ongoing trust building and follow-up. A few barriers we faced included limited printed materials about available resources, time constraints during busy clinical days, and no formal workflow to document social determinants of health in the electronic health record at the clinic. So, what does this mean for my future as an FNP? This experience has had a profound impact on how I plan to practice as a family nurse practitioner. Here's what I've learned. Social determinant of health screening must be normalized and integrated into everyday patient care, not seen as extra work, but as part of the clinical picture. I plan to advocate for the use of a consistent screening tool in any clinic I work in and to build strong referral networks with social workers and community organizations. Most importantly, I've learned that even small interventions can make a big difference in someone's life, like helping them find a way to get to their appointments or access healthy, quality food. Thank you for joining me today on Beyond the Chart. Social determinants of health are the missing pieces we've too often overlooked. But when we start asking the right questions, we can truly begin to provide whole, patient-centered care. If you're considering implementing a similar project in your clinical setting, go for it. Start small, stay consistent, and never underestimate the power of listening. I'm Michaela Gilman, and I appreciate your time today. Looking forward to hearing your thoughts and feedback.